Any health-related information on the following show provides general information only. Content presented on any show by any host or guest should not be substituted for a doctor's advice. Always consult your physician before beginning any new diet, exercise, or treatment program.
Welcome to Accelerated Health with Sara Banta. I'm a busy wife, mom of 3, and an NANP certified supplement professional, but that's not all. I'm also the founder of the multi-award-winning Accelerated Health Products, a brand offering innovative, natural, scalar-enhanced supplements to optimize your health. And this podcast is not just a source of information. It's a community. We're all here to grow and learn on our health journeys, regardless of where you are today. And this podcast is the springboard to learning, and the free group coaching on Telegram is where we continue learning together. You ask your questions, I post tips and tools to deepen your health and keep you motivated in moving forward on this journey. So here's what you can expect. New episodes every Monday and Wednesday with in-depth health discussions and expert guests, hot topics that are in the news every Friday to keep things really fun, and the free group coaching, of course, to follow it up, where you get to ask those questions like, wait, I heard something that you said, but I didn't understand it. So you can find all the details at SaraBantaHealth.com. Have you thought about detoxing, but you're a little worried if it's too much, or if you're going to be starving during it, or you don't want those detox flu symptoms? Well, I've created over 10 unique, easy detox cleanse programs to help you reset your body while feeling great. You're not hungry. You're eating real food and the food we're going to be talking about with our guest today, and you get results. So if you don't know where to start, just take the detox quiz at SaraBantaHealth.com to find out which one's right for you. You can start with the colon cleanse just to get pooping. You can do the parasite cleanse, the candida cleanse, the liver flush cleanse, or the big one, the accelerated diet cleanse that gives you a full reset naturally and increases that metabolic health and that mitochondrial health. So you might not be ready for a detox, but you want to start with some supplements and don't know where to start. Just complete the health goals form on my website, and I will personally put together a protocol for you. Just by taking a few steps forward, you will change your life. And the difference is I'm here to help you every step of the way. Well, today I'm super excited. We've got one of my very favorite guests back, Jay Feldman. He's a health coach, independent health researcher, host of the Energy Balance podcast. You absolutely need to be following him. He uses bioenergetic approach to help men and women from around the world maximize their cellular energy. And that is the goal. And Jay, I've learned so much from you, and I've incorporated a lot of your teachings into my teachings and seen only good results. So it's funny how you were way ahead of the game when it was like, don't be on that low carb diet. Don't be on that keto diet. And everyone's like, you've got to be wrong. But you're coming out to be the right one. And it's so fun to watch all of these other big podcasters and big people going, yeah, I think Jay was right. So thank you for being here. I'm super excited about the topic we're going to get into today on hormone therapy. And this is another topic that you are probably going to upset some people about, right? So first off, why don't we start with, this myth about hormone therapy, whether it's thyroid medication, hormone replacement therapy, you've got the men on the testosterone, why it has become so popular with the population today.
Yeah, that's an interesting and I think a good starting place, because there are two central reasons that come to mind. One is that I think a lot of people are hurting in terms of their hormones, and they're feeling the effects of that. And there's a lot of ways that can show up, and it might vary a little bit if we're talking thyroid versus testosterone versus progesterone. But I think there is definitely an epidemic in terms of hormonal issues, and a lot of people are experiencing those symptoms as a result. I also think it's a Band-Aid approach that leads to, in many cases, somebody feeling better or having at least some improvement in symptoms. Not always, of course, and there's reasons why we want to be cautious that we'll get into, but it can be something that leads to a pretty immediate effect, a pretty significant benefit without needing to change much other than, take a pill or use a cream or something like that. And so that those two things together, I think, make it really attractive. But as we'll discuss, don't actually solve the underlying issue. And that doesn't mean we never want to provide hormonal supplementation. There's absolutely a place for it. And it can be life-changing in cases. It can make a huge difference. But I think at the same time, we need to be really careful about when we're using it, how we're using it, and also that we're introducing it, I guess, in the right context.
Right. And before we came on, I started telling you about a story about my daughter, 18 years old. Here we are in a new world. We had the pandemic, and there's a lot of viral activity going on. I have to be very careful with how I speak about this. But let's just say that what happened with her was a result of the current environment, and her ovaries reacted. She became extremely estrogen dominant. Progesterone was in the tank. Her PMS symptoms were through the roof, level 12. But what was different than before was that the level 12, which we had gotten down to a level 5 prior to a couple months ago, came back up with a vengeance to 12, but then it stayed all month long. It did not go away. It wasn't just the one day and then it eased and then we were back to normal. And the pain is excruciating, vomiting, can't eat, extremely anxious, a lot of the typical symptoms that come with low progesterone. And she was losing weight. She's an athlete. She needs to gain weight and gain muscle, and she needed to be working out, and she couldn't get out of bed. So you can imagine then this vicious cycle of the anxiety that is added on top of the anxiety. And as I was going through this, watching it as a mom, it was horrific, but I was also hearing more and more stories of estrogen dominance, low progesterone, hormonal imbalances from all ages, from men. Testosterone's in the tank. That's no, mystery. We've got the microplastics and the modern day toxins that are really wreaking havoc on hormones and testosterone. But we have the menopausal women where their menopause symptoms are getting worse. We've got just infertility. That's going down in both men and women. So we have all of these hormonal issues going on. And so I take my daughter to a doctor. And I am blessed to have multiple practitioners from the most holistic to the most Western medicine. And then I filter the information and I hopefully make the right decision. So we go to the medical doctor. Progesterone's in the tank. Here's the progesterone prescription. And until she starts, or until day 14 of her cycle, I want her on pregnenolone. So when you do progesterone medication, you only start mid-cycle. So I had this window of 14 days to figure out if, is this going to be the right decision for us to do or not? And with the pregnenolone, just for being on that for 2 days, that appetite that was already squashed, causing her to lose weight, got even worse. She wasn't even drinking water. She wouldn't eat a thing. Like I would try to give her applesauce. She wouldn't get anything in. And I thought, okay, we're going in the wrong direction. I then saw my other practitioner who said, no hormones. This girl cannot process anything. Her liver is so locked up from the viral activity, and hormones are fat-based, so she can't process any fat, let alone fat-based hormones. That's only going to make her worse, which I had seen over 48 hours just with the pregnenolone. So my point in saying this and starting out with this is I saw it firsthand. I saw that you can't just throw the end result how do you say it? The end result hope to fix the problem. You've got to get down into the root. So what did we do for her? We used antivirals. We used things to bind up her excess estrogen, like calcium D-glucarate. We used supplements like the acceleradine iodine that helps with hormonal balance, and it's antiviral, and some other things. And lo and behold, that girl has put her weight back on. She's working out and thriving just like she should be. But she's just one example. And she's 18, and we've got people in their 70s and 40s and all, both genders, whatever, suffering from all of these things. And you throw hormone at it, it's not going to work. One other quick example, a man in my life, low testosterone, tried testosterone therapy, didn't see results because his adrenals were tapped. They were done. So there was so much stress in the life that the body's not going to react to anything. So with that as kind of the base of our conversation, I want to get into, what is wrong? What is the root cause? And, why throwing testosterone or thyroid hormone or progesterone medications at the problem may not work or could actually backfire.
Yeah. Yeah. And I would say at least shouldn't be the first step. It might be a step on the path toward healing and recovering, but I don't think it should ever be the first step or probably anywhere in the first several steps. And that's because, as you said, we're definitely not addressing the root of the issue, right? There are many things that regulate the state of our hormones. And if we are not considering those different things and we're not trying to improve the things that have led to the situation in the first place, then we can certainly get into trouble and we can see worse symptoms for sure. Or what can also happen is, and you see this with TRT a lot, you mentioned TRT, is you can cover up the symptoms by providing the testosterone, but in the background, all of those signals that led to the low testosterone are still there. And those aren't just low testosterone signals. Those are turn down your metabolic rate signals. Those are things that impair your immune function. And if your body is in a state, and I know I kind of jumped ahead here, but if your body is in a state where it's saying it is not ideal right now to have high testosterone levels, we shouldn't be favoring reproduction and things like that, and then you add testosterone on, you're basically reprioritizing the body's energetic needs externally. Instead of it regulating itself, you're choosing to regulate it. And that means that the energy that it was conserving, that it was choosing not to put toward, let's say, reproduction, you're stealing that away. And that the energy doesn't come from nowhere. You have to steal that away from other core functions, whether it's digestion or brain function or otherwise. So if we're to back up and say, what can drive these issues? What are some of the root issues? I think it's helpful to consider that our hormones are chemical messengers in our bodies that help our bodies determine where to allocate resources and how to properly respond to the environment it's given, how to best fit in with that environment. And if we have a good, abundant environment that provides the nutrients we need, a lot of energy, it doesn't contain the toxic, in this case, estrogenic things that are in so much of our skincare products and cleaning care products and on and on and on. We can talk about those. But if it's a good environment free of harmful things and providing a lot of the really good things, then it's going to lead to a hormonal state that reflects that. It's going to lead to a lot of energy production in the first place. It's going to lead to really good baseline functions, and our body's going to say, great, this is a time where reproduction is something we can favor, right? We have the capacity to provide for a baby, for another human. And it's not going to be too taxing on us. And that's something we can favor right now. And we can favor the growth of, let's say, again, on the testosterone side, the growth of muscle tissue, right? We can take excess energy and put that toward building muscle. And these hormones are not just reproductive hormones, whether, we're talking progesterone or testosterone. They affect everything. They affect cognitive function and have amazing capabilities there. Progesterone is something that's being studied for regenerating the brain, regenerating neurons. Testosterone has major benefits in terms of recovering from fatty liver, as does progesterone. I mean, on and on. In every system you look at, there are benefits to these reproductive hormones. They're definitely not just reproductive hormones. And so coming back to, again, the root here, if we're in an environment that is supportive, where our bodies can say, let's maximize our function, let's not only favor reproduction, but let's work on regeneration, let's work on kind of optimization and maximizing our potential, that's the situation where we end up in what we call a good hormonal balance, what we would call having enough of these pro-metabolic hormones, like the reproductive hormones and like thyroid hormone as well. And when we're talking about thyroid hormone, it's not just the production of these hormones from the thyroid, but also that we're effectively converting the inactive hormone T4 to the active hormone T3. And there's a lot of regulation at that step. And when we're in that state where our bodies are saying, this is a great environment, food, water, sunlight, stress, on and on, we're in a good spot there. And when that's not the case, it starts to adjust, right? It starts to tweak and shift what it wants to prioritize so that we can still survive and still function in the long term. And so when we then get to that point where our environment has not been great due to all the many insults that we're dealing with in our modern society, and some of the things that maybe we do to ourselves in the name of health, things that we think are healthy,
Right.
Maybe we've done a lot of really excessive exercise. Maybe we're not eating enough or enough carbohydrates, as you were mentioning earlier. When we do those things, it's going to, and it leads us to the state where we're not in an optimal place hormonally. We want to go back to those roots. We want to make sure that we're addressing those foundational things, as opposed to just throwing the hormones on top. And we can talk maybe a bit later as far as when it does make sense to bring those hormones in. But I think that's kind of the big picture here. That's the starting place.
I just had someone text me this morning, hey, I don't understand this. My T4, I feel more fatigued and I'm gaining weight. And I was actually just put on Synthroid, back on Synthroid. And I said, well, there's your problem. That could be converting into reverse T3. I said, what was your reverse T3 on your test? And what was your free T3? She said, well, my doctor didn't test them. And I'm like, wait a second, you're a thyroid patient and you're not getting your free T3 and your reverse T3. And that also brings up the topic of lab testing versus how do you feel. But before we get into that, I would just want to emphasize something that you said, is that your body's smart. It will survive, and it only has so much energy. It's like, how much money do you have in the bank? Okay, if I only have $20, am I going to put it towards a Lamborghini? No, I'm going to use it for some food or, the basics of and fundamentals of your life. And so when there's stress, and that's where I thought we could really use that as the springboard into this, is that stress, that cortisol, whether it's you're being chased by a tiger or you have a stressful job or you're exercising too much or you're not eating enough. Your body just sees those all as the same stress, and it's going to start shutting things down and reallocating its use of energy. So maybe you can talk about the cascade and domino effect of high cortisol and how it affects your testosterone, your thyroid hormones, even your liver, and then what that looks like manifesting into symptoms.
Yeah, I think that's a great place to start. And especially because when we are lacking energy, when every cell in our body needs energy to function, we call that ATP. And when we're in a state of deficiency there, and we have a deficit in energy, there are certain hormones that are produced to help make up for that deficit. And cortisol is one of the primary ones there. And while it's really great to have that in the moment to help make up that deficit so we can continue doing whatever we need to do to survive, to function, it acts as a signal in the long term. If we're seeing consistently elevated cortisol more and more, it acts as a signal that we're seeing constant energy deficits. We're in a constant deficiency of energy. And the farther we go down that spectrum, the more cortisol we see, the more we see the downstream effects of cortisol. And again, as you said, our bodies are smart. So cortisol will turn down the production of thyroid hormones. it will, and this is part of why you might have a normal TSH level on a blood test, but if your cortisol is elevated, that TSH could be just suppressed by the cortisol, and it could actually be covering up a hypothyroid state. The cortisol will also reduce the conversion of T4 to T3. So you can have a lot of the inactive T4 hormone. That's the synthroid levothyroxine that almost everybody's given when they're given the hypothyroid diagnosis. And oftentimes there's going to be elevated stress hormones and liver dysfunction in states like that. And so we're going to have poor conversion of that inactive T4 to the active T3. And so your TSH looks normal, but you're not actually feeling any better. You're not actually rid of any of the hypothyroid symptoms. And so that's another effect of the cortisol. Cortisol will also directly reduce the reproductive capacity. And it does this largely via testosterone production. So it'll decrease the hormone called GnRH, at the hypothalamus. It'll then lead to lower testosterone production, lower reproductive hormone production, lower progesterone production. It also has direct effects at the reproductive organs themselves, at the ovaries, at the testes, and impair or reduce the production of steroid hormones there. So everywhere you look, whether you want to look at the machinery in the cells that's producing energy, you want to look at the function of our liver, you want to look at the function of our immune cells, you want to look at the function of our brain. If you add cortisol in there, it has a general depressing effect in the long term. It slows everything down. And this is well known as well as a side effect of high amounts of cortisol in the form of glucocorticoids that are prescribed as medications. Not only do they cause things like weight gain and swelling and edema, but they also are well known to interfere with the reproductive capacity, to interfere with the reproductive hormones. And so, again, to reiterate here, this is an adaptive, beneficial response to a poor environment. This is how our bodies properly respond to the poor environment that they might be exposed to. And in the same way that we don't want to just replace the hormones that we've decreased, we don't want to just stop the cortisol per se. We want to stop the need for it. We want to stop the underlying state that's creating a need for the cortisol. And that comes back to the energy deficiency. And you mentioned a couple of the things that can cause this. This can be everything from chronic infections to a lack of sleep, to a lack of sunlight, to so much of the terrible things in our food supply, the excessively, the crazy amount of polyunsaturated fats, the nutrient deficiencies, the pesticides, and on from there.
And I mentioned in the beginning with my daughter, she had to go on a zero fat diet for just a couple days. I don't recommend that long term. But that was even the healthy fat. So you can imagine the PUFAs and the damage that would have done to her and this is the girl that has never had a weight issue in her life. She's the one that says to me, Mom, I don't have to eat the way you tell me to eat because I can do whatever I want. Well, when it then started affecting her hormones in her liver, she definitely looks at food a little differently. But that brings me to the liver because I talk a lot about the liver, and I've gone through my own experience over the last couple months where my liver enzymes, I eat clean. I eat all wild meat. I eat according to your plan. I eat the right carbs, whole food, prioritize the right proteins, and fill in. I don't tend to do well with high fats, so I tend to more be a higher carb person. But even doing all the right things, my liver enzymes were over 700. So would probably have put a doctor out. Like if I had gone to a medical doctor, they probably would have passed out and wanted me to get a liver transplant. I don't know what they would have done. Anyway, with that being said, my free T3 was in the tank and my testosterone was in the tank. But this is the other interesting factor. I had always in my life been anemic, and I had fixed it, but I've never been high in iron. My iron and ferritin was very high. And so I literally was rusting from the inside out. That was burdening the liver even more. So maybe and I don't know if you're seeing this more with our environment over the last couple of years, with livers just being totally backed up and overburdened, that the ferritin and iron is actually on the high end of people instead of the low end, and how that can affect the thyroid conversion and liver health in general.
Yeah, that's a great question. So when it comes to elevated ferritin, there can really be, I would say, two primary drivers. One is excess amounts of iron that we're putting into storage because there's so much iron, there's way more than we need. And this can lead to crazy high ferritin levels. I've seen them in the 700s, maybe 800s as well. And this is especially in people who are eating lots of red meat. Maybe they're on a carnivore diet and it's the only thing they eat. And that's a time where I tend to see very, very high levels of ferritin. It can happen even if someone's not on a carnivore diet as well. But these are times of, there are situations basically of iron overload. And an iron overload, as you said, you basically have rusting from the inside out. Basically, that iron is extremely reactive and will amplify oxidative stress. And this definitely has a huge effect at the liver and is a major contributor to fatty liver disease and liver inflammation and the progression of fatty liver disease. And they have studies where they chelate iron in those situations and it helps to protect the liver. And it's not just there, it's everywhere. It'll happen in the brain, it'll happen in the vasculature. Excess iron is absolutely a major concern. But it's worth noting that you can have elevated ferritin and not have excess iron at all. You could even have low iron potentially if we're in a major inflammatory state. And one of the more common drivers there is a microbial or bacterial infection. And in a state like that, our bodies recognize we don't want to have a lot of excess iron because it is basically flammable. It's very, very prone to damage and can really make things worse. And it can also promote the growth of microbes and infections. So that's a case where even if there's not excess iron, the body will move that iron into storage and ferritin to try to keep it away from damage and from those microbes. And so there can also be cases where there's elevated ferritin, but there's not actually an iron overload issue. And instead, this is something that can be driven by an infection. And in that case, you're also going to have major liver issues in most cases, not necessarily because of the iron, but in this case, because of endotoxin. So endotoxin is one of the most toxic components of bacteria. The chemical name is lipopolysaccharide, and it's shortened to LPS. And LPS is one of the things that's primarily responsible for liver damage, liver dysfunction, fatty liver disease. It's highly associated with metabolic syndrome, obesity, diabetes, cardiovascular disease as well. And if we have excessive amounts of bacteria, overgrowth of bacteria in the gut, producing a lot of endotoxin, this will cause inflammation in the gut. It'll cause intestinal permeability in the gut. And when we absorb that endotoxin, it'll go through the liver. That's where we detoxify it. But in the process, it creates a major inflammatory state there. And so this could be another scenario where we might see elevated ferritin and some major liver issues, although in this case, we're seeing it driven by this endotoxin problem, which when we're speaking of some of the more common drivers of issues, endotoxin is way high up there. Gut issues, bacterial issues are way high up there because, again, talking about the compromised state that so many of our bodies are in, that allows for infections to take hold. It allows for bacteria to overgrow when our stomach acid is low, our bile flow is poor, our motility is poor, our immune function is suboptimal. So this can be a major driver of liver issues, of thyroid hormone conversion issues, of testosterone issues, of progesterone issues, estrogen dominance as well, can be driven by endotoxin.
So just as an example, then you throw on a TRT to get your testosterone up, but you're not taking care of the endotoxins or the overload of bacteria or pathogens. And what I'm seeing is also a huge amount of candida and parasites in the body. And people don't know that they have all that in there because they're numb, because they don't know what it feels like not to have it in there. And when we talked about stress on the body, yes, there's the stress of your finances or your kids or your marriage, but what about the stress inside the body from the endotoxins that you have nothing to do to? You don't feel that. That's not something you're doing anything about, but your body is under stress. And so it's going to do what it has to do with all the things that we've been talking about. in adjusting your hormones and prioritizing certain aspects of your health. So one thing I want to talk about, because yes, a lot of people, well, most people are suffering from hypothyroidism, and a lot of the listeners especially are focused on their thyroid, and there's supplementing with just T3. How is that not helpful if you're not addressing the issue? And I'm not saying that this medication is not right for certain people, but like you said, it shouldn't be the first step. What should people be tackling first before going to that step?
Yeah, it's a great question. And one thing I want to come back to that you mentioned was, adding TRT on, adding in testosterone if there's an endotoxin issue. And I think that's a good example of why that's not a good first step, because in this case, not only does endotoxin lower testosterone production, but it also increases aromatase. Aromatase is the enzyme that converts testosterone into estrogen. So one of the last things you want when you're trying to provide extra testosterone is extra estrogen. And if we don't address the root of the issue, that testosterone that we're taking in can be aromatizing and be converting to excessive amounts of estrogen, which causes all sorts of effects that we don't want.
So that is just like taking more T4 if it's only going to be converted into reverse T3 and it can make you worse. So just wanted to use that as the same type of example.
Absolutely. Yeah. And the reverse T3 can actually inhibit the T3 binding into the cell and its activity. So you actually have an anti-thyroid effect there. So yeah, that's the exact reason why we don't want to consider these things as first steps. And you mentioned T3 in the case of hypothyroidism. And one of the great things about T3 is you can circumvent a conversion issue. So unlike the T4, where we can take it and it can convert to reverse T3 if we have these issues, if we take the T3, that's not going to happen. However, if we're in a state of hypothyroidism, oftentimes we're in a high stress state, as you were saying, internal stress. And that's a state where we're not effectively producing energy. We don't have enough energy available. And what T3 does is it increases our metabolic rate. It's like pressing on the gas pedal. And if there's not enough fuel in the tank, or we're not able to effectively convert that fuel into energy, and we press on the gas pedal, we can create a lot of damage. We can cause the stress to become even worse. And it's also worth noting that in a hypothyroid state, we have increased sensitivity to the stress hormones. So one thing that can happen really often if we bring in T3 before someone's ready is they notice stress symptoms, anxiety, heart palpitations, insomnia, sometimes extreme hunger. Sometimes it instead is more of a fatigue presentation. But you can increase the exact stress that we're trying to avoid, that we're trying to decrease. And so with that in mind, what we do want to do as far as those first steps go is start with the most foundational things that affect our energetic state, that affect our health. This comes back to things like getting enough of the nutrients we need, not just the micronutrients, the vitamins and minerals, but also the macronutrients. We're getting enough protein, we're getting enough carbohydrates, and we're getting enough fat to provide the fuel for our body's needs and the building blocks that our bodies need. Along with that, we want to make sure we're getting the vitamins and minerals in. And we want to make sure that we have good digestion, right? We're not dealing with the constant influx of endotoxin, and we're also effectively breaking our food down so that we can absorb those nutrients that are coming in. And it's, effectively passing through in a way that's not going to stimulate the growth of bacteria or candida, parasites, and those kinds of things. And then a couple of other real fundamental ones. One would be blood sugar regulation. And what that means is that we have properly spaced out meals. We're not, again, there's always exceptions, but we're not kind of grazing throughout the day, but we're also not fasting and we're not skipping meals, because each of those have their own negatives to them. If we're skipping meals, we're going to be increasing cortisol and other stress hormones, which is going to decrease things like testosterone and T3. And that has been shown in intermittent fasting studies, where it will actually, again, not doing full day fast, multi-day fast, those we already know for sure, those sorts of fasts will have these effects, but even just the intermittent fasting can lower testosterone and can lower T3. And so we want to make sure we're eating consistent meals, and that they're well balanced, right? If we're eating a meal that's really high in protein and very low in carbs, we can have the same effect of increasing glucagon, adrenaline, and cortisol as a way to help re-regulate the blood sugar. And so we want to make sure we're having at least enough carbohydrates in every meal, and ideally with a balance with some amount of protein and fat. And so those are some of the foundations, but we also have things like sleep, right? Just a lack of sleep alone is going to affect stress, affect insulin sensitivity, affect thyroid hormone production. Sunlight exposure is huge, not only for things like vitamin D, which is often pointed to, but it actually has direct effects in terms of stimulating the production of steroid hormones, like testosterone and progesterone. So getting enough sunlight is massive here. And there's a couple other foundations, but coming back to the question of when is it appropriate for maybe taking the next step with the hormones, we want to make sure we're at a point where we've addressed those foundations and we've seen the improvements along the way, and we know that we're heading in the right direction. But there can be, for some of us who have spent decades digging in the metabolic hole, right, that we're now stuck in, it can take a long time for our bodies to recognize that we're in a good environment and they're able to shift out, and we can increase our metabolic rate. We can restore proper reproduction. Sometimes that's not even weeks or months. Sometimes it can take years to fully recover there. And if we are confident that we're on the right road and we're providing the right support, then we might be ready to press gently on the gas pedal with some of these hormones and encourage our body, or kind of artificially provide the signals that are saying that our environment is good, right? We're kind of artificially providing these good environmental signals, these signals of abundance physiologically. And we want to be careful in doing it, but that's the situation. That's the time when I might consider it. And yeah, it's after those foundations have been addressed, we're confident we're on the right path, but we're still stuck in certain ways, and we want to slowly and carefully speed the progress up.
I like the word abundance that you use, because I think the mindset, and your mindset has so much to do with it. Women especially are always, we've grown up in an environment where we're told to restrict. If it's not working, restrict more. Work out more, eat less. Work out more, eat less. And just going back to the bank analogy, now I only have $15 in the bank. I'm not going to spend much money because I don't have much there. But if you have that abundant mindset of energy and, if I eat more, I'll spend more. And the thought of like, if I eat more and it's converting into the energy, I'm going to have more energy to go for a longer hike, or play with my kids with more energy, or get off the couch for more hours during the day. It will convert. But it's the mindset too of believing that your body is working and that the messengers are being sent to the right place, and that will lower the stress, because just by having a restrictive mindset, you are going to increase your stress just out of the box. But back to the example of my daughter, and then I know that I've heard you talk with others about, the pre-hormones like pregnenolone, DHEA, DHT, some of these hormones. Can you talk about how those may backfire as well? And they may not convert into what you're hoping they're going to convert into?
Yeah, so there's a handful of possible concerns there. So there are certain hormones that can interconvert, and certain ones that don't so much. And part of the concern is what might they convert into in the wrong environment. Part of the other concern that maybe is an important place to start, because I think it's mostly ignored, is that each of these hormones have their own effects. So pregnenolone is considered like the pro-hormone, right? It's after cholesterol, the first steroid hormone that gets produced is pregnenolone, and that's the precursor to every other steroid hormone that we have available, from estrogen to progesterone to aldosterone, and on from there. And I think people are sometimes overly concerned with what the pregnenolone might convert into, and less concerned with the effects that pregnenolone itself has, because just on its own, without converting to any other hormones, it has its own effects, and generally they're really positive effects. It actually reduces the conversion into some of the downstream hormones that we don't want. Like it inhibits aromatase, the one that produces estrogen. It inhibits the HSD, the 11-beta HSD that leads to cortisol production. So it has some some really good benefits in that regard. It also has direct effects inside the mitochondria. It has a stimulating effect there metabolically. These can be great things, but just like T3, which is something that is incredibly vital to a high functioning organism, it can, if we're providing it in the wrong context, it's, again, we're stepping on the gas pedal when the engine's not working, or when we're talking like the bank analogy, it's like we're overdrawing from the bank account. We're we're accumulating interest. We can go a few different routes with the analogy, but the same applies for pregnenolone, where it does have a pro-metabolic effect. So that can be part of the reason why it can have some stress effects in people who are having negative effects from it. Or we could take something like progesterone, and you were talking earlier about this the kind of epidemic of restriction for women, and I think there's also an epidemic of infertility, of menstrual cycle issues, of low libido. I mean, it's awful what I think in what has been forced into the environment of so many women in like Western society. But when we talk progesterone, which can be so helpful if used properly, it can also cause major aggravation of symptoms, because one of the things that it does is it helps to clear estrogen out of the tissues where it can be stored if we're not ready to handle it. Mm-hmm. And if we have some liver dysfunction, let's say, and we have major stored amounts of estrogen, and we bring in progesterone, we can have a huge release from the tissues. And then if we're not effectively clearing it through the liver, because that's where we detoxify the estrogen and then send it through either the urine or through the bile into the stool, if those things aren't working well, or if let's say our motility is slow, causing us to reabsorb lots of estrogen, there's a lot of ways for things to go wrong here. But if those aren't in a good place, we can have a major increase in symptoms from providing a really beneficial hormone in progesterone, which comes back to the question of reasons to be careful with these hormones. As you said, some of them being pro-hormones, some of them being kind of the end products, but there's certainly reason to be careful. And then, as you were alluding to as well, something like DHEA, which is really often recommended in extremely high doses, can aromatize. So DHEA has an androgenic effect, and normally that's why someone would use it. They want the androgenic effect, they want to increase testosterone, but can also convert to estrogen. And if we're in a general stress state, if we're dealing with endotoxin, if there's a lot of PUFA, then we can be converting that DHEA to estrogen and creating more havoc. So,
what's crazy is DHEA and pregnenolone can be bought off of Amazon. So it's at anyone's disposal. They don't know what they're doing with it. It might backfire, like you're talking about. You might be getting a crappy brand that has something that you're not expecting in it. And that can go for any supplements. But it's such an intricate balance. Our bodies are so complex and they're so smart. And they just want to survive. They want to use their energy to what is their priority, and that's going to override what you think your priority is, right? And so I'm trying to think with some of the symptoms that people are experiencing, where should they go? We're going to look at the diet. We're going to, do we do a full blood test? Do we knock out those first few things that you talked about? What is the game plan?
That's a great question. And testing can be deceiving, for sure. So, and I can dig more into that in a second. What I would say a good starting place is learning to tune into our bodies, right? So looking at, we've got a lot of symptoms available to us, or a lot of indicators, a lot of barometers available. How well we're sleeping. Are we waking up during the night? Are we dealing with swelling? Do we have like a clear head, or are we dealing with brain fog? Are we dealing with anxiety? Do we have bloating or slow motility? Those are the kinds of places we want to start. Joint pain and eczema. Like there's a whole gamut. But what we want to see is that those, kind of like the hormones, those are steps away from what's going on underneath, right? Those are reflective of some sort of dysfunction underneath. And so we want to use those as our indicators. And as a starting place, right? And as we start to make those changes, as we try to, improve our diet and get good movement in and get in the sunlight and reduce our psychological stress, and we see those things improving, that's great. The areas that we aren't seeing improving, maybe we need to see, to provide some extra support. And I prefer that because I think it can be simpler and it's something that everybody can do. It does take time and practice, but so does getting blood tests and understanding and interpreting them too. And there can be a lot more complication there than I think people realize. And it's not just true for blood tests, it's also true for the urine hormone tests and things like that. As an example, we could see low estrogen levels in a urine test, and we might assume that means that there's lack of estrogen in the body. But instead, what can be happening is that we're not effectively detoxifying it in the liver, so then it's not ending up in the urine, like in the urinary metabolites, because it's stuck internally, right? It's either in the tissues or it's even stuck in the liver, but we're not effectively clearing it. And so we could have major estrogen issues despite it being low in the urine or low in the blood. There's certainly a place for testing. I think it can provide more information if we're interpreting it well, but I prefer that we go to that if it's necessary, and I think in a lot of cases it's not. And speaking of symptoms and indicators, when we're talking female hormone imbalance, using menstrual cycle symptoms can be really, really helpful here. I think you were mentioning with your daughter some severe PMS symptoms, but seeing those things improve month over month can be really helpful as an indicator. And length of the cycles and consistency, and looking at body temperature, making sure that it's going up after ovulation. Like there's a lot of different built-in ways that we can, if we're monitoring properly or we're kind of listening to what our bodies are telling us, they tell us a lot about the state of our hormones. So that's normally my recommended starting place is learning to tune in there as opposed to jumping to the testing, which again, I think there's a place for, but.
And I love that you mentioned the body temperature, because most people don't have 98.6. We are all hypothyroid in that respect. And that's an easy free test. And just go get a thermometer, take your test, and see where your body temperature is. I know when I was younger and I was taking the temperature of my children, it was always 97 something. That's not normal, but we assume it's normal because that's the new normal. So that would be a good step one. And I love that you say address the digestion, address the liver before addressing the hormones, because those are where things are made, filtered, detoxed, produced, all of the things. So Jay, and another amazing conversation. You are such a wealth of knowledge, and I'm so grateful for you. Where can people find you?
Yeah, thanks so much for having me, Sarah. If listeners are looking for a good place to start with one of the most important foundations being diet, I'd recommend they head over to jfeldmanwellness.com/guide, where they can sign up for a free energy balanced food guide, where I have it's a one-page infographic and lists all the foods based on how well they support your metabolism and which ones to be more careful about if we're dealing with digestive issues. So I think that's a really good starting place. And again, listeners can find that at jfeldmanwellness.com/guide.
Awesome. Thank you so much, Jay.
Yeah, thanks for.
And for all of you, I just want to recap. I mean, yes, there's a place for hormonal therapy. I'm not saying there's not. I'm not saying that I'll never do it, because I may, but I'm going to address all of the things that Jay and I talked about first, and 2 supplements that just really get to the base of it that are no-brainers. Acceleradine iodine. Why? It helps the thyroid gland. It provides the T2, 3, or the 2, 3, and 4 molecules of iodine for the T2, T3, and T4, which regulates the metabolism, liver function. It cleanses the blood so the liver can do its job. It balances the estrogen and progesterone. It increases that ATP inside the mitochondria. It helps with the iodolipid value of the cell membrane to allow the toxins out and the nutrients into the cells. Remember, it's all about cellular energy. And then it cleanses the blood. It's antipathogenic. It's antibacterial, antiviral, antiparasitic, and it reduces inflammation. So many things, just as a fundamental for what we've been talking about today. It helps improve insulin sensitivity as well. It helps with your heart health because your heart health is tied to your thyroid. And it also helps just the synergy of the thyroid and the liver. It detoxes the body of the halogens like the fluoride, bromide that impair metabolic function. So the second one is accelerated liver care. I mentioned in the podcast that my liver enzymes were over 700, not where you want to be. Within 2 weeks of taking accelerated liver care, they came down to below 90. Now, that wasn't normal range yet, but within 2 weeks to make that drastic shift, that was impactful. I will be going back to getting another blood test as well. But accelerated liver care is packed with 13 herbs that synergistically work together. We have picked them from around the globe, the very best to promote liver detoxification, rebuilding the liver, reducing inflammation, regenerating the liver cells, and it targets fatty liver disease. It improves insulin sensitivity and so much more. It, of course, is enhanced with scalar frequencies as well. So I hope this was helpful in a world that's super confusing with hormones. You are going to get 5 different opinions when you go to 5 different practitioners. So you've got to filter the information yourself. Thanks for listening. Our discussion does not have to stop here. If this was confusing or you're feeling lost, I'm here to help. Just join me in the free group coaching. That's a great place to start. You can ask your questions there or start by getting your free supplement protocol. Head to SaraBantaHealth.com, complete the form, and get a personalized protocol just from me. Follow me on social media at Accelerated Health Products. You can follow this podcast, Accelerated Health with Sara Banta, on Spotify, Apple, YouTube, E360, iHeartRadio, and over 100 different platforms. Share this podcast. Not only will it help the algorithm so I get better guests to share with you, but you're also helping me spread the word to help more and more people take control of their health. You can use coupon podcast10 to get 10% off your first order. Remember, I'm live every Monday, Wednesday, and Friday, so join me next time for more ways to unlock your health potential.